Successful treatment of anorexia nervosa requires a multifaceted, integrated approach. My immediate recommendation for Carrie's parents would be to remove her from school until she has improved. It appears that for Carrie, school was a great source of stress, and this is probably what precipitated her eating disorder behaviors. Secondly, education would be necessary. Carrie and her parents should be provided with the information and materials necessary to confirm that eating disorders are a real disease. There is a biological explanation. Research has connected eating disorders to genes and brain structures. It also reveals that family members are at a heightened risk of developing this psychopathology. The risk is 6 times greater than that of the general public. Twin studies further strengthen the argument for genetic determinants. The risk is significant for twins. It's estimated between 50 to 85%. Serotonin is also a factor, a potential contributor to eating disorders. It influences depression, which is common in bulimia nervosa, and it also may be responsible for stimulating the urge to consume large quantities of high carbohydrate foods. Lastly, it is theorized that each person's body is designed to naturally maintain a particular weight. In other words, the weight set point. When one weighs less than the weight set point, the brain generates hunger and the metabolic rate diminishes. A strong appetite may generate a desire to gorge on starchy foods. Biological research does answer some questions. However, the picture is incomplete without psychological perspectives. However, I would like to add that drug therapy is an option, but because of limited effectiveness, it's normally not recommended. The goal of psychotherapy is to establish a strong therapeutic alliance and have the client complete an eating disorder inventory so that she then can progress towards better behavior. The cognitive behavioral approach is extremely important to helping Carrie identify her core pathology, the issues that are deep-seated for her that impact her behavior. In other words, Carrie's relationship with food needs to be analyzed and understood. Unfortunately, at this point, Carrie sees food as something to be controlled and not sustenance and nourishment. Cognitive behavioral therapy can also change her desire for autonomy. She needs to be more assertive in this area and needs to assert her independence. She doesn't always have to attempt to placate to others or play the people-pleasing role. It would also help her to recognize, interpret, and trust her own emotions and physical sensations. The urge to vomit is a natural function, but it's meant to remove something hazardous from the body. Carrie can be taught that vomiting is not a method for maintaining a healthy weight. When viewing a fashion magazine and sensing sadness or depression because of these skinny models, she can stop and monitor those feelings. She can learn how to monitor her feelings, her attitudes, her eating patterns, and behavior by recording her reactions in a diary. The contents of her diary can be read and discussed with the therapist during sessions. This form of therapy can also help her improve her coping skills. It will allow her to navigate peer pressure appropriately, and role playing, modeling, and even video can help her to rethink and restructure how she behaves. Lastly, cognitive behavioral therapy can employ a progressive reward system that is based on the amount of weight gained and maintained. Family-based treatment is exceptionally important. It allows the therapist to take on the role of consultant. The family is usually in a crisis situation, and when the therapist takes on the role of the consultant, the power differential shifts. She's no longer the person of extreme expertise and the person to be sought for answers. She becomes a person who can consult them and work with them. Family-based treatment also allows for the separation of the illness from the patient. It's externalized from the patient. This allows the family and the patient to view it as a real disease. It also promotes the reduction of blame and guilt within the family structure. Family-based treatment helps the family to take ownership of the problem by having them personally assume responsibility for feeding Carrie. When she is not in the care of medical professionals, her parents and her family members are responsible for feeding her and making sure that she does not purge, regurgitate, or take diuretics or enemas or laxatives to reduce weight. Lastly, family-based treatment can help the family become aware of troubling family interactions. The enmeshed family pattern needs to be broken. Family communication problems can be eliminated, and also they can be taught how to handle situations so that family conflict does not become a major issue. The primary reason cognitive behavioral therapy is so important is that it will give her an opportunity for individual therapy. There may be subject matters that Carrie is not willing to discuss with her family or even discuss in their presence. It's something that she can do on a one-on-one basis in individual therapy. Also, individual therapy allows for concentration solely on Carrie. It allows for the patient-counselor relationship to begin, and Carrie then will get an understanding that the counselor's primary loyalty is to her. Also, the rationale for including family-based treatment: while a family may be comprised of several individuals, they make one unit. For the unit to function well, all individuals must be healthy. They must be able to communicate effectively and interact in an effective manner. As with any form of therapy or treatment, there's always a potential for complications. One of the major issues related to anorexia nervosa is that of denial. The victims usually deny the fact that they have a medical or psychological issue. Therefore, they may not be more attuned to starting therapy or medical intervention. Suicidal ideation is also an issue. There's an increased heightened risk of suicide amongst victims of eating disorders, especially anorexia nervosa. Relapse is also a potential. Purging desire, fear of weight gain, distorted body image, and low self-esteem may be part of the cycle for any person who's ever experienced anorexia nervosa. There are several factors that affect the prognosis for Carrie. Her age is a positive factor. There's also a 90% improvement rate for those that receive psychological and medical care. Relapse may be in her future. However, it is usually precipitated by a stressful event. So if she really does hold on to the coping skills that she's gained through cognitive behavioral therapy, she may not experience relapse. Weight gain, the idea of weight gain, and her appearance may always plague her. Depression, obsession behavior, and social anxiety may also plague her as well. However, there is a bright note. Because she has overcome anorexia nervosa and her body weight is normal again, her chances of being fertile and having children increases significantly. Thank you for enjoying my presentation.